Okay, good morning, everyone. If I can have your attention, please. We have a really special addition to today's Bond lecture, and that is the induction of our 2020-2021 Alumni Hall of Fame Award winners. We typically do this at our spring graduation, but we decided to attach the Alumni Hall of Fame honors to this special event this year. The Alumni Hall of Fame is actually an idea that came from a trainee about 5 or 6 years ago, and we thought it was a fabulous one. The purpose of the Alumni Hall of Fame is to honor graduates of one or more of our training programs who have done exceptional things in the field of psychiatry and who have also generously given back their time to educate future generation of psychiatrists. So in addition to wanting to pay honor to our alumni, we also wanted to inspire our current trainees in our programs, and we hoped that the Alumni Hall of Fame would attract future brilliant, wonderful psychiatrists to our programs. So 3 purposes in starting this Hall of Fame. Now, today we're doing something a little bit different in that we are inducting our first ever class of winners. So instead of 1 individual, we will be inducting 4, and they will join Dr. Robert Ronis, Dr. Miriam Rosenthal, and Dr. David Agel. So what we're going to do now is I'm going to have each presenter of the award come up. We're going to do the awards in alphabetical order. So for our award winners who are here, we're going to say lovely things about you. And after we say the lovely things, if you could come forward, and we have an award to actually present you with today. And I think we're going to try to get a quick picture when you're down here getting the award. So first up is Dr. Andrew Hunt, who will be presenting to Dr. Norman Clemens.
Good morning. It's my great pleasure to offer comments in honor of Dr. Drew Clemens as one of this year's inductees into the UH Psychiatry Alumni Hall of Fame as a graduate of the residency class of 1964. This is a personal honor for me to introduce Dr. Clemens because I had the opportunity to train with him in several contexts in residency. He taught my class as well as other classes at that time. And then at the Cleveland Psychoanalytic Center, I trained with him in the psychoanalyst training program for many years. Dr. Clemens was born in Wilkesboro, Pennsylvania, near Scranton, and attended Wesleyan University to complete his BA in 1955. He then went to Harvard Medical School, where he was exposed to psychiatric medicine through rotations at Massachusetts Mental Health Services, where he trained with George Valiant and was a contemporary of Anton Chris. And he described early knowing that he wanted to be a psychiatrist because of these experiences, seeing chronically mentally ill patients in the hospital and wanting to do something about it. This is during a period where psychiatric medicine was very prominent and also new modalities coming out. Psychoanalysis in its heyday, as Dr. Ronis alluded. He also enjoyed deeper long-term relationships with patients where he truly got to know them and understand them as people. And he found psychiatric work challenging and deeply intellectually fulfilling to be involved in. And he also discusses reading Theodore Reich's writings at that time and explorations in psychoanalysis as being a major influence on him. Dr. Clemens came to Cleveland to do his medicine internship during a very exciting time in psychiatry in Cleveland, where he trained under Dr. Robert Ebert for his medical internship with the intention of going into psychiatric residency. And he says in asking him why he chose to train here in Cleveland, I'd like to quote a recent address he made to the American Psychoanalytic Association audience. I stayed in Cleveland because it is a beautiful city for living and the arts, and because Western Reserve Medical School had pioneered a dynamic, integrated new curriculum that the unacknowledged experimental model for my first year at Harvard. UH of Cleveland had initiated a psychoanalytically oriented residency program that entailed active interaction between psychiatry and other services. Psychotherapy was taught throughout the residency, along with ECT and the earliest psychotropic medications for depression, anxiety, and psychosis. Faculty member Brian Bird's book, Talking with Patients, became a model for a practical, wise clinical consultation and engagement with patients. Our chairman, Douglas Bond, had served in the U.S. Air Force in England during World War II and been able to learn about psychoanalysis with Anna Freud in London. He had worked psychodynamically with American flyers who had returned from harrowing flights, suffering what we now call PTSD. He brought people who had worked with Anna Freud in London to Cleveland to establish a pioneering therapeutic nursery school, now known as Hannah Perkins. I find it particularly interesting that the reasons that he chose to train here are the same reasons I chose to train here in 2006, about having integration between services, psychiatrically and psychodynamically informed consultation, sort of at the heart of the reason that I came here. At UH residency, Dr. Clemens trained with Patrick Duffy, with Dr. Douglas Bond, Dr. Lankowski, Dr. Ed Harper, Dr. Charlie DeLeon, and Dr. Brian Bird supervised several of his early psychotherapy cases. While in residency, he says that he enjoyed developing groups for alcoholism, some of the pioneering kind of work in alcohol substance use treatment. And he also really became focused on the practicality of this integrated model of medicine and psychiatry. Throughout his career, Dr. Clemens has found himself as a leader in times of challenge and change in organizations, in societal norms and cultural standards, and in medicine in general. During residency, he wrote a paper that documented the consequences of closing mental hospitals without providing adequate community care to receive patients who are suddenly no longer confined, as impacted in emergency room visits. Following residency, he received NIMH funding to do a clergy mental health course that he led for 10 years with the Cleveland Mental Health Association. He was a member of the American Psychiatric Association starting in 1969 and became Speaker of the Assembly of the APA from 1994 to 1995. He was also the Ohio Psychiatric Association president from 1986 to 87, where he served on many committees and wrote many important position papers with teams of psychiatry representatives, including addressing issues such as confidentiality, access to care, parity, documentation in psychotherapy, the importance of psychotherapy in the context of psychiatry in general, health system reform, and achieving access to health care, government relations, and business relations. He also held prominent roles in the American Psychoanalytic Association, including being on the Executive Council from 1979 to 1981, and Counselor at Large from 2013 to 2017. He was president of the American College of Psychoanalysts, an organization that Douglas Bond was also president of for a period, from 2015 to 2017. In the Cleveland area, he was president of the Cleveland Psychoanalytic Center from 2002 to 2007. During the course of his career, he has maintained his relationship to the department. Even during this period of tumult where the department split with the psychoanalytic community, he maintained a relationship with training with the medical school. He has been faculty of the medical school since 1963. He taught medical students from 1963 to 1997. So a huge span of time dedicated to medical training. And he directed the core clerkship for psychiatry for medical students from 1968 to 1988. So 20 years of directing the core clerkship. With respect to the residency program, he's maintained his relationship to that since graduating, and has supervised countless residents in their psychotherapy. He has been supervising psychotherapy cases with residents since 1964 to present. He's been a supervising and training analyst since 1993 at the Cleveland Psychoanalytic Center. In 2011, he won the Department Faculty of the Year Award from our residency program. And in 1995, he won the APA Nancy A. Resnick Teaching Award. So, to me, Dr. Clemens represents many of the values that we hold dear in psychiatry. He is at base a pragmatist, a practical proponent of all things that work in psychiatry, all things that are effective, and all things that get the job done of taking care of patients and understanding people. He says that his favorite things from his career are seeing residents getting woke and connecting with their patients in a way that they understand, in a deeper way, understand the value that residents can bring psychotherapeutically to their patients' lives, and seeing residents really grasp the power they hold in people's lives and in their connection to human beings. I want to reference a paper that he wrote towards the end of his editorial role at the Journal of Psychiatric Practice, which I feel is particularly inspiring. This is entitled An Open Letter to Early Career Psychiatrists. Fundamentally, the outcome of psychiatry will depend on the willingness of psychiatrists at all levels to insist on the conditions required to assess patients properly, to establish good therapeutic alliances, to manage medications correctly, and to conduct individualized psychotherapy under the right conditions. You have to be assertive. Psychiatrists are in demand, you have choices, and that empowers you to speak up. To me, this really embodies the firmness that I know of Dr. Clemens, the assertiveness, the willingness to lead, the pragmatism, the wish to not throw out things that work and help, and that can be of utility, and the centrality of humanity in the process of psychiatry with a biopsychosocial perspective.
I'm Dr. Robert Ronis. I have the pleasure of introducing our next recipient. Many of you know I often refer to the Department of Psychiatry as a family, but actually our next two awardees are family, as they both had the good sense to marry sisters. While some might say their professional expertise runs to very different areas in psychiatry, they both have become nationally recognized experts in the area of commitment. In one case, commitment in loving relationships, and the other commitment of the involuntary type. It is my pleasure to introduce the first of these brothers-in-law, Dr. Steve Levine. Dr. Levine earned his MD at Case Western Reserve in 1967 and completed his residency at Hanna Pavilion. His clinical practice began in the mid-1970s as the University Hospital's Cleveland Sexual Dysfunction Clinic. In 1993, the clinic and his professional and dancing partner, Candace Risen, separated from University Hospitals and became the Center for Marital and Sexual Health in Beechwood, Ohio. Steve's early work focused on premature ejaculation and erectile dysfunction and other treatment options. He has published extensively on sex offenders, including professionals who offend. Steve has written about adultery and infidelity on the clinical management of gender identity disorder. He was chair of the 5th edition of the Harry Benjamin International Gender Dysphoria Association's Standards of Care in 1998 and served on the American Psychiatric Association's DSM-IV subcommittee on gender identity disorders. Dr. Levine served as co-editor with Taylor Seagraves for the section on sexual and gender identity disorders in Treatments of Psychiatric Disorders by Glenn Gabbard. Other notable contributors included Martin Kafka on paraphilias and Kenneth Zucker on gender identity disorders in children and adolescents. Although much of his work is written for clinicians, Steve has written books for the lay audience, including Sex is Not Simple in 1989, Solving Common Sexual Problems in 1997, and Sexuality in Midlife in 2004, Barriers to Loving, A Clinician's Perspective in 2013, and others. He, Candace, and longtime colleague Stan Althoff published the Handbook of Clinical Sexuality for Mental Health Professionals in 2010 and have seen it through multiple editions. One reviewer wrote of the text, "This unique and meaningful text personalizes the experience of working with patients struggling with clinical issues of sexuality. The authors are refreshingly transparent about their own therapeutic successes and failures, their evolving viewpoints, and their thoughts about various diagnostic criteria. The true gems of this text are the vignettes that punctuate each chapter." Stephen Levine's goal was to provide an accessible, personal, and useful volume for mental health professionals seeking to treat patients with sexual health, relationship, or sexuality issues. Dr. Levine and his co-authors have succeeded masterfully. This book should be a welcome addition to any mental health practitioner's library. And this review in the Journal of Clinical Psychiatry is by a Dr. Jean LeCamp, who you'll be hearing from in a few minutes. I first heard of Dr. Levine when I was a first-year medical student, and my wife Lori was a head nurse at Rainbow Babies and Children's Hospital. She would tell me she always knew when Dr. Levine was giving a grand rounds because half of the nurses would disappear over to Hanna Pavilion so that they could swoon over Dr. Love. I suspect had we sold tickets at the time, we would have been able to complete several more endowment funds for the department in those years. When I returned to Cleveland for my residency in psychiatry, my first assignment was on Ward 31 at the Wade Park VA, where I had Dick Karate and Phil Resnick as my inpatient supervisors. One of my assigned patients, who was in nearly constant residence at the VA, had served as a tragic teaching case for a series of residents, having attempted unsuccessfully to complete his own gender reassignment surgery in the bathroom of the VA emergency area. I struggled to understand this awful and desperate act and the official conclusion that his act by definition defined his ineligibility to ever have his surgery completed, and sought Dr. Levine's help. While the wisdom of his clinical experience may have prepared Dr. Levine for the inevitable conclusion of this case, he never failed to demonstrate compassion and empathy for the patient nor for the trainees struggling to understand this phenomenon. Steve has always been a generous colleague and friend, whether volunteering to present at grand rounds or beating me so soundly at tennis that he worried for my health. Lori and I have been fortunate to get to know him and Lillian in more recent years, and I still haven't figured out why I keep getting older while he stays the same. It's my honor and pleasure to award Dr. Stephen Levine with this year's Department of Psychiatry Alumni Award. Steve, please come on forward.
Next up, we have Dr. Susan Hatters-Friedman, who will be inducting Dr. Philip Resnick.
Yeah, it is my great pleasure to introduce my mentor, Dr. Philip Resnick. Dr. Resnick, everyone knows in the department for his amazing teaching, but he's also known as an international leader in the field of forensic psychiatry. He's a role model for so many of us, but he's also a highly approachable and available person. Many of us remember the first time him telling us to call him Phil, which is very hard because of his esteemed status. So some things you might not know about Phil: he's a local Clevelander, almost lifelong. And not only did he train here, but his undergraduate was at Case Western with a degree in psychology, as well as medical school, where he attended Case Western. He did have some time away from Cleveland when he served in the United States Army, ultimately attaining the rank of captain and working in hospitals. Now, Dr. Resnick is well known in the field of forensic psychiatry, which he began by publishing several landmark papers regarding women who killed their children, which has remained an important part of his career, and many of us have continued to carry the mantle of this important work. Dr. Resnick's papers in the late 60s were the first papers to think about the motives that women have and men have for killing their children. And something you may not recognize about him is this man actually coined a word in the English language. So the word neonaticide was coined in the 60s by Dr. Philip Resnick to mean the murder of a child by their mother in the first 24 hours of life. And further papers and work went on to describe that this phenomenon is very different from mothers who kill their children at other times in life. So since those landmark papers in the 1960s, you will not be surprised to know that he has published hundreds more articles, both research and commentary, and pushing our forensic thought forward. Now, in addition to his work at university hospitals and Case Western, Dr. Resnick for decades served as the director of the Court Psychiatric Clinic in Cleveland, which is in the Justice Center, and became very well known around the Justice Center as well. But it was 1979 when he began Case Western Reserve's Forensic Psychiatry Fellowship, which is known as one of the finest fellowships in the country. Case Western is certainly also known as one of the most demanding and intense forensic psychiatry fellowships in the country. And Dr. Resnick has been intimately involved in teaching dozens and dozens of fellows over the many years. But hundreds and hundreds of residents and students, and then learners from all over the country and all over the world. So Dr. Resnick is such an international leader in forensics that, for example, say you were to move to New Zealand, everyone would ask you, have you had the opportunity in Cleveland to work with Dr. Resnick? Say you were to go on sabbatical to Kyoto, Japan. People would ask you, have you had the opportunity to work with Dr. Resnick, or London, or anywhere else you may go? Dr. Resnick has been a national leader in forensic psychiatry for decades. Interestingly, after the verdict in the United States versus Hinckley, he was asked to give testimony in front of the National Commission on the Insanity Defense in 1982. A couple of years later, in 1984, he was elected president of the American Academy of Psychiatry and the Law, APPLE, which is our field's organization. He was also the founding president of the Association of Directors of Forensic Psychiatry Fellowships 2 years after that. Dr. Resnick has been awarded all of the major awards in our field of forensics. He was awarded the Seymour Pollack Distinguished Achievement Award, the Isaac Ray Award for Outstanding Contributions to Forensic Psychiatry, the Golden Apple Award for Significant Contributions to Forensic Psychiatry as well. Now, he has not slowed down over time. He continues to present courses at the annual meeting of the American Psychiatric Association. I believe the largest number of courses. And he has also been running the APPLE American Academy of Psychiatry and the Law review course for many years. Now, personally, I met Dr. Resnick in 1996 when I was a little medical student taking his law and psychiatry course at the Case Western School of Law. So He lectured to us in medical school and also in the law school class. And his speaking was so exciting, and it was hard to believe that this is a job and you actually get paid money to do this thing, forensic psychiatry. Dr. Resnick has also been involved in many nationally publicized trials: Jeffrey Dahmer, Timothy McVeigh, Terry Nichols, Ted Kaczynski, Rusty Weston, Andrea Yates, Scott Peterson, to name just a few. He is well known for his wit and his forward thinking in our field. He's also been a very active member at the Group for the Advancement of Psychiatry, GAP, for many years. And as everyone here knows, he continues to teach residents in his highly anticipated lectures and the mock trial series, which only makes people slightly anxious in preparation for that. As well, Dr. Resnick is a father and a husband and has a lovely wife, Lois. So it is my honor and pleasure to help induct Dr. Resnick, a leader in our field and a well-known person in our department. Congratulations, Dr. Resnick.
All right, last but certainly not least, Dr. Jean LeCamp will be inducting Dr. Ellen Rothschild.
Hi, good morning. I hope everyone can hear me okay. And something that Dr. Rothschild herself would well understand, we just got message that one of our patients is having a behavioral emergency. So I'm going to feel a little rushed in my presentation, but I will hang in there. So it's my pleasure to join you this morning. Graduating from Columbia University College of Physicians and Surgeons in 1955, Dr. Ellen Rothschild did complete psychiatry training in 1962 and dedicated herself to patient care and teaching and mentorship, both at UH and at the VA. This was at a time when less than 10% of physicians were female, and it is, of course, to echo Bob's presentation from earlier, Ellen was a crucial part of our department as we were forging relationships at the Cleveland VA. During the earlier presentations today, some themes kept coming back that seemed so appropriate and applicable to all of the inductees today. That of being an active educator, being involved, being warm, approachable, available, open, and challenging the people that they were teaching. And as I reflected on Ellen, those certainly held true. I also earlier found two quotes that seemed perfect for Ellen's impact. One was, education is not the teaching of facts, but the training of the mind to think. And the second of which was, educating the mind without educating the heart is no education at all. Over the years, Ellen has received awards from medical students as well as residents as a tribute to her impact on those that she was teaching. Certainly, personally, I recall meeting Ellen about 13 years ago, so much more recently than folks who have had many decades of a relationship. She was spirited and bright and always so engaged, an eager participant in every element that she was participating in, and certainly a steady presence for us at our annual Spring CL Society meetings. She taught, she mentored, and she was a wonderful example to trainees in that venue. Her questions, her feedback were offered with kindness and a genuine interest in the trainee and their learning and their experience. She always shared good humor, her signature energy, and as a group, we were so much better for having her presence. Throughout the brief time that I've known Ellen and in hearing the memories of others, Ellen really embodies the impact of not focusing on herself, but as an educator and as a participant, an active participant in her work and her life, rather focusing on others, whether it was her loving relationship with her husband, Irving, who was also a case professor of reproductive biology, her enduring friendships with some of the other women trailblazers in our department, such as Dr. Mim Rosenthal, and others, hundreds of people who have learned from her. it is no doubt that Ellen Rothschild is such a deserving recipient of this award, and I'm just really thrilled to be part briefly of this awards presentation. So all my congratulations and appreciation to Ellen.
Well, this concludes our awards for this morning and at least our portion of the Alumni Weekend events. I want to invite all the honorees and their guests, and frankly, we have such a big room here. Anybody else who wants to join us to come on over to the Intercontinental Hotel, the North Coast Cafe, which is across from where table 45 is. We have a table reserved, and we'd love to have a little breakfast with you if you're able. I'm going to walk over if anybody wants to walk. It's a few blocks for those who want to drive. There is valet parking there. But thanks again for coming.